Perfect. So na kusha na kabo, na my name Timu John Fuller, na me na presenter for the WBBPG Gentri program. When a Saloma don't learn boku book, they bring this program to now. The young people are we all know they one place, they scatter all over the world. Everybody get different experiences. Some of them are salon and train. Some of them don't train outside, some of them don't practice outside as well. But we did all over the world, some with the UK, some the Germany, some the US, everybody scatter all over the place. But we see and say it beneficial for people and for let they give this program free to now. Nobody know they pay we. In fact, now we save they lost money. Okay, we decide no more for do this program for let we will give back to the people them. Wait till they get so for this program, and some man they pay, but when they get a free of charge. So if you know anybody who feels they will benefit from this program, they are pass the message around other people and benefit. Okay, this now with 75 session. We only go now for over 3 years. I think is it 4 years now? I think it's about 4 years now. We don't go. This our 75 session. Today we deal with meningitis. And Miss Nafisatu Sumaray, and I present to you today. Go tell you everything we need for know about meningitis. This they're not designed for medical people, and designed for me and you, the average Joe, we don't understand anything about medical stuff. So we be able go through and see exactly what we need for look for if something go wrong, when we need for seek medical advice, and if we seek medical advice, one of the things they will for ask about, how we go about for manage, if we get the condition, how for manage them, then kind of thing. Nine Auntie Nafi will talk to that today. But today is Sunday, the 21st of April. And my own name, like I said, Timu John Fuller. And when I get the WBBPG Gentri panel, we will help now for ask any question when I get. Do you have a family them? Now, general advice will they give, they give a personalized advice. So to say we don't want to do one because we not get to a medical background, I make we not go do one. Okay. So if they give any example similar to you, not similarity no more, it not means in you will they talk about directly. Okay. So as I say before, we as salon people that we around the world, we decide no more say we come together for give on this program for provide benefits to our community. None of we not they get paid, but we hope say wait till they give so it will benefit. Elect now one person benefits in our community. We believe we will achieve waiting we set out for do. Okay. Like I say before, we go share this program on social media. It go there on Facebook, YouTube, and also we get a WhatsApp page. WhatsApp forum where if you want the recorded version, we can send them to you. We don't charge anybody for them. Once we don't record them, are free for anybody for access. Okay. And also, dear them, I will forget if anybody get access to any radio, TV, and mainstream and media at all, feel free for get in touch. We not go charge anybody for giving the material. But which number we don't want to do, we know they pay for the air we program. No, because we don't give the program for free. We feel say it will be beneficial for the people and get them. However, we did in talks at the moment. Maybe we don't never know on I might be seeing this program regularly on a TV channel. Them. But still, if somebody gets any other avenue, we feel free for get in touch. We'll be happy for for engage somebody and see exactly how we will make this accessible to people them with the backup. Like what they say before, if you want to ask question, most of them like this one they see on a phone them or tablet. Then 3 dots here. If you press on them, it will show you see follow you chat. That chat you can chat the guy chat on WhatsApp or Facebook. Feel free. You don't need to speak perfect English for let's send message. Speak any kind of English way as long as you're able to make sense out of them or somebody on the panel able to make sense out of them. We go try for answer your question. Na Krio ask mo, it's fine still, whatever it is, as long as not too obscene language, we'll go try for see how we will help out. Okay. Like I say, if you're not able to ace your hand up physically, maybe you shape or whatever. If you're Sabi technology, you can raise your hand by pressing this button. But if you're not Sabi all then you're not worry, just ace your hand physically. When I see you, I'll come to you. Dear me family, if I not come to you quick, it not means I ignore you. It just means I not see you, but I will come to everybody. And dear me family, they can mute everybody for allow the presenter to present. And at the end of the presentation, when I will get ample time, and I will get enough time for them to ask any question I want to ask. And the panel day, not to just Antinafi, no more the other doctors in there on the panel as well. We will come on board and try for help for answer on a question. If that's until we're too personal, we're not able to answer them, we will take them offline and try for engage you. But like what I say, we're not able to give personalized advice because we not get to the medical history. Okay. So I can't do now over now. Thank you very much. If I get any feedback, questions or suggestions, we're not perfect. If I think say anything they will be able to improve on, or a particular subject we want to but we not be done deal with before, or we don't deal with them before, but if you say maybe for cover them again, feel free for get in touch. Now email down there and our WhatsApp number down there. That number in our WhatsApp message number, you'll be able to send it. Not any other message, and you're not able to call them. Okay. But send a WhatsApp message or you send me an email. We will respond to you and we will try for take on our suggestions and feedback on board. I bet you not don't tire for hearing my voice. Now I'm not to the professional. We will take on through the session today. Antina, over to you.
Thank you so much, Mr. Fuller. Let's share my screen now. This is all.
Yes, ma'am.
Okay. Share my screen.
Until if you unmute yourself, yeah?
Yeah, I unmute. Unmute. When they see my screen?
Yes, yes, we see now. If you put on presentation mode, then
yeah. Good evening, everybody. Thank you for joining. So I don't hear from my colleague, Mr. Fuller. My name is Nafisatu Sumaray, but people know me by Nafi. I'm a nurse by background. I trained in Sierra Leone many years ago. Then I moved over here to the UK, continue to work as a nurse, but I don't move away from clinical hands-on patient nursing into public health. So for the past 11 years now, in public health I do. I mainly the work on infectious diseases, part of public health, and non-infectious hazards, things like chemical spillage, land contamination, carbon monoxide poisoning, but mainly infectious diseases. So today I tell you about meningitis when I'm infectious disease. And we will talk about then the content which you see on the screen. So now all of these I will get for tell now. When I will get for see me, they maybe turn me face away from the camera because I use two different screens them. And this one where they on my left and I get the camera, and this one at the big screen when I see better. So today what we will go for cover, I will tell you now what's meningitis. We will talk about global statistics, which we know all around the world about numbers in terms of meningitis. I will tell you about the types of meningitis. When are they at least so, we get viral, we get bacterial, fungal, parasites, we get non-infectious one, acute one, and chronic. We will talk about them one a day. Then I will tell you now how meningitis they pass from person to person, from one person to another. We'll talk about signs and symptoms. We'll talk about risk factors, everything they put person at risk for get meningitis. And we will also talk about how then they diagnose meningitis. Where you go see the doctor, you know, well, waiting the doctor will do for make you take and say, yes, this is meningitis, now this person get. We will also talk about how they go treat them. Then I will tell you about the complications, what will happen in the after effect where somebody don't get meningitis, what will likely happen. We're going to talk about how to prevent meningitis. And then we're going to talk about the public health management, because when somebody get meningitis, the doctor then they do their own, then the public health team they say they do their own. Waiting public health people then they do, I will tell you about that as well. Then we will talk about what in WHO want let the one whole world do in terms of how to make meningitis come out as a public health problem. Then finally, we'll look at take-home message. We go comprise of all it we don't talk like a summary of everything I don't tell you now. We'll take it down there and take-home message. So meningitis now is serious infection where they affect the cover of the brain. The brain, when I want to see so now, when I end inside this person's skull, now the brain on the see so. They get three cover them. Then call them the meninges. Medical terms, they call them the meninges. Then cover them, then they cover the brain and the spinal cord. And if you see on this diagram, this is the meninges. Now three meninges, now in the brain, now they cover the brain. This first one named the dura mater, the other one named arachnoid, the other one named pia mater. When they're normal, when they don't get no problem, now so they look like they're not swell, you know, they're not red, they just look normal. But this other diagram here, so when they see say the cover then swell. See, it's swelling, not only swelling red. So when somebody get meningitis, now this now they happen. They get infection of the cover of the brain and the spinal cord. Usually, na infection can cause that. Means the way the body don't become infected or the brain don't become infected with germs. When germs then they go inside, they infect, now they cause them. But other things they can cause them. The incubation period where person get meningitis now about 4 days, but it can range from 2 to 10 days. When I say incubation period, I mean from the time where the germs they enter the person's body to the time where the person they begin show symptoms. That period between them time and Now we call incubation period. So for meningitis, it can take like 4 days, but it can range from sometimes from 2 to 10 days. Now, thing we can kill quick. So now make when the person gets an immediate medical attention I require because it kill somebody very quickly. Meningitis na different kind germs that they cause them. We get germs that when a bacteria they cause them. We get the one that when a virus. We get other germs that when a fungi and then a parasites. Different kind that they cause meningitis. But the one when the bacteria one, and the common one, and it's dangerous. And that one day they kill person inside 24 hours. If a person gets them and not seek medical attention quick, it can kill that person within 24 hours. And then tell they don't care. They say that person been sick. Now waiting do they say now one day fever no more get. Before they can go hospital, you don't die. Sometimes the meningitis na so they behave. So now make you take them very serious if they suspect say somebody get them. It affects any kind of age. It affects pikin, it affects big person, it affects woman, man, old person, young person, anybody can get meningitis. And it can lead to serious complication then. If it not kill you, some people they say where they recover from, where they well, they can well with complication, where they can live with for the rest of their lives, and then they end up with disability safe, where I will tell you later on in the slides. And meningitis is a major public health challenge, a major global public health challenge. That means to say all over the world, meningitis is a problem and a cause for concern. So what do you know about meningitis in terms of numbers around the world? Meningitis is the number 6 largest killer disease in the world. For all the diseases that they kill, meningitis is the number 6. Then 2.5 million people, more than 2.5 million people around the world now they get meningitis every year. When they check the people who get meningitis now over 2.5 million. Then 230,000 people and more than that number they die every year from meningitis. Now on this so see what this possibly don't die possibly so 230,000 more than that they die every year for meningitis around the world. And for picking the meningitis now the second cause of death per picking the way they under the age of 5 all around the world now the biggest killer for picking them. And number 2 now the second biggest infectious disease killer for picking the way they under the age of 5. So the system meningitis is a problem. Not only safe now one part of the world now, all sign a problem. Well, I will tell you just alone see. We get something we call African meningitis belt. Now a geographical area in a sub-Saharan African country them. When country then they will fall within the African meningitis belt, then get high number of meningitis cases and outbreak them. So if you see on this diagram here, this yellow side, so where they run from the west Naya to the east Naya, now then they call the meningitis belt. Any country then will fall within this yellow portion where they show now so now meningitis belt then call them. The reason we make them call them belts now because now they say I fever belt, they run from one end to another. So they run from Senegal Naya so now the west part of Africa up to Ethiopia and the east part. And think about 21 countries then fall within this meningitis belt. So WHO we don't take them countries also as meningitis belt because they get high rate of meningitis now this side they can get outbreak them. We got one bacteria where I will tell you more about later in this presentation. They call it Neisseria meningitis. They're all over the world, they cause this meningitis disease. But this bacteria is more common at this meningitis belt area there. Now the more you see, the incident the boku de. Me say the other side, boku na that side. Then they say the sickness, this meningitis sick, now this meningitis belt area there. They say in more boku people where they less than or 30 years of age, up to 30 years of age. Me say they catch other people they move, but it's common among that age group of people and then this meningitis belt area. And then say even pasmak self now and picking the way they between the age from 5 to 14 years. People will fall within that age, they pasmak panel. But for country the way they outside of the meningitis belt, when I then green side all when I see so when I this salon say fall. Thankfully, we're not inside the meningitis belt, but me say we not get meningitis case in a salon. So we say get meningitis case, the only thing the way they affect the hand within the meningitis belt, is different, it not be the same with salon. So country the way they outside the meningitis belt. Now picking them more with adolescent then, and adult the way they over the age of 80 years. Now then they catch boku. Me say they catch other group or either age group they will more common by them people here, where they outside country they will not to meningitis belt country. So what do you know about salon? Salon, we say in 2002, we get outbreak of meningitis now one town where they call Kubola town na Koinadugu district. That time the meningitis, it killed 13 people in that town day. And 300 other people they get for on away, they left the tongue, they afraid. Because people they die now, 13 people they don't die, they afraid, they left and come on at the tongue. So then one information I find out about outbreak who don't get nasalo, even when we're not inside the meningitis belt, we still get outbreak. So we say for concern. This was shown as a data with WHO. Pull I think that this 2020 in this come out. This all analysis on meningitis information nasalo, but the died and way happen nasalo per meningitis inside 2020. They say the died will be happening at Salo. 1,415 people they died in Salo. And meningitis and kill them. All that died and they, if you see down here, so when I see the meningitis one on highlights now, and then they show up here. And for all the died will be died here, this amount, now die when a meningitis cause them. Then they like 2.3% of the died will be happening. And then they put in the rate of meningitis for any 100,000 people in a salon. 18 people will die of meningitis. So the science is a problem. And the rank we say that we did number 7, but the one who was alone number 7, we can have meningitis problem. And number 7 now be. So you see, so this is a big number for 1,415 for die of meningitis. So other countries they not reach this. Very small. So you go to any 100,000 and 10 at 10 9 go die. Who get 1,415. So what are the different types of meningitis that we get different types of meningitis as I've been telling now. We get viral meningitis when a virus they cause them. In a contagious, it means they pass from one person to another. But sometimes they can go away, you know, can need treatment safe. Or some people they can need treatment, they can treat them. So all the virus they are at least under this viral meningitis, now they cause viral meningitis. But I don't go through them all. I will just list and the number for now, let us see. The one where we focus on more today are the bacterial meningitis, where I've been telling now, where I've been begin talk for saying are the most dangerous and uncommon, and they kill people within 24 hours. So the next one down na bacterial meningitis, instead of a contagious one, it means they pass from one person to another. It can be fatal, it can kill people inside 24 hours if they don't do anything about it. Then for any 10 people where they get this kind of meningitis, 1 can die. Then for every 5 people where they get one person can, even if he live, he will live with complication. Then he go get for live with for the rest of his life. So now a very serious condition. If it can kill you quick, if you not seek medical attention, and if you not kill yourself, it will left you with complication. The way you go for live with for the rest of your life. And later on in this presentation, I will tell you about them complication indeed. So then different kind of bacteria we list under there. So now then are the common one they will cause bacterial meningitis, but the other boku one them back where they cause them, but this is not just the common one there. Today I tell you about bacterial meningitis, and we'll go focus on this one here where they call Neisseria meningitis, when one of the type of bacteria where they cause meningitis. This one grain bacteria, they get 12 different type then of them. And for then 12 type, then are 6 type now in the way they cause common for the cause outbreak of meningitis or the cause meningitis from people then. And then 6 type, then are A type, B type, C type, W type, X type, and Y type. And then they cause an outbreak there. So we'll look at the type here all later on in the slides in the presentation alone and see how meningitis is really dangerous sick where we not for play with at all. We get fungal meningitis where you're not contagious, they pass from one person to another. And even there, you're not common safe. If they enter the body, they can spread, go to the bloodstream, and it can go affect the brain and the spinal cord. Most time people are worried the immune system not strong, where then soldier man then their body, where they fed, so we get soldier man where they fed sickness, we don't make infection kind of body, now then they call the immune system. People are get weakened in immune system, and the more now then this fungal meningitis can catch. People will get cancer, they will get HIV, they're more likely for develop this kind of meningitis. And all them fungi then they were listed under this, so now then are the common type there where they cause fungal meningitis. You get other type when a parasitic meningitis, instead not contagious, instead less common compared to viral and bacterial meningitis. We can find an then dirty type and then stool, animal and food, then like a snail, raw fish, and then chicken side, and then chicken them. So this kind of parasites can come up and then thing they did. And then at least just 3 common one then way can actually cause parasitic meningitis. Then we get meningitis we call non-infectious meningitis, where not to germs they cause or not the infection they cause more. It's not contagious at all, they pass from person to person because obviously not an infectious one. So now people will get medical condition like a condition we call lupus. Lupus now is a type of autoimmune disease. When it's autoimmune, now where you the body soldier they were supposed to protect you from infection. And then they turn back and attack your body again. So you can get some patient in a lupus can get they affect their joints, it can affect their skin. And sometimes the way you get the most severe type, it affect the brain, and they can get meningitis because you could not affect the brain and they affect the brain cover then why we don't talk about. So people who get lupus can suffer this non-infectious type. Head injury, of course, somebody get accident, either if you're in a kid or motoka bang you in a head or somebody whap you or whatever head injury you get, sometimes it can lead back to meningitis. Brain surgery, if you get surgery in your brain, you can prone for get non-infectious meningitis, where the brain cover then will become inflamed, probably as a complication of the brain surgery. And then you get cancer of the brain self can cause and certain medication then where people can take, where can go affect their brain and can cause meningitis, we're not too contagious one at all. Then we get acute meningitis, which means they just get a new episode of infection we just get. Then they themselves we can get a new one, we person just get them for the first time a new acute meningitis. We get chronic one, where if the symptoms they don't last longer than 4 weeks, we take and say a chronic meningitis 90% get. And that kind meningitis it can cause by fungi or cancer or rheumatoid arthritis when another type of joint problem and autoimmune disease. Obviously, if na bacterial meningitis, we don't talk say it can kill person within 24 hours. And not possible, it's not go easy for like to be chronic one, because if it lasts for 4 weeks, when most times if the person not seek help, it cannot kill you before that time, or even if you seek help, you go well, but so maybe you well with complications. So most like now the fungi and the one they will get cancer, one of them can last for 4 weeks. So this now, what I don't tell now so far are the different types. And now they can focus now on the bacterial meningitis, when we focus for today for this presentation. So bacterial meningitis, as you can see, now different kind of bacteria in the cause them. Them bacteria, I've been all list them previously, just on a then slide they were shown, they all list them. You get the pneumococcal meningitis, when a pneumococcus bacteria, they cause them. You get Haemophilus influenza meningitis, the one bacteria when they call Haemophilus influenza, and they cause them. You get Staphylococcus. We get meningococcal meningitis, when this meningitis, this bacteria, what they talk about so today, when they call Neisseria meningitis, and they cause this disease, what they call meningococcal meningitis. And we get tuberculous meningitis, when the bacteria, what they call TB, and instead they cause them, it can affect the brain. Then we get pediatric, when for picking the bacteria, the way they affect picking, the way they cause meningitis. So this one, what they talk about today, meningococcal meningitis. When somebody gets Neisseria meningitis, this bacteria in the body, now one of two things that happen, or two will happen. It either gets meningococcal meningitis, which means say, now the brain cover and the spinal cord cover, and they don't become affected, they don't become infected, they don't become inflamed, they don't swell up. It go get that one, or it go get something called meningococcal septicemia, which means say, blood poisoning. It don't affect the brain, but it don't poison the whole system with the bacteria. The blood all don't become poisoned. And sometimes they say some people can, unfortunately, they get all two. They can get meningococcal meningitis, they get meningococcal septicemia. So we can't talk about the meningococcal meningitis today, when I really cause for concern all over the world. So how did it pass? When person get meningitis, how did it pass? Well, as when I say it pass from person to person through droplet infection. We see on the diagram, so where the man cough, cough by mouth, or somebody we inhale that cough the way the person coughs, so bacteria and can be inside. The bacteria and inside that cough they can other person will carry inhaler. And if the person not protected for meningitis and not get vaccine for prevent them and not protected, insect can catch them through that way they inhale that droplet of bacteria, the way they come out the person mouth or nose where they sneeze or cough. Then, for let person get meningitis from somebody, if you get close contact with the person, it just means that somebody pass 2 seconds away, you don't pass. No, people mostly where they get close contact with. What I will tell you later on in the slide, in this presentation, what close contact mean. Some people they call and say they're an asymptomatic carrier then. What that they mean is that they get the bacteria, now their nose or their throat, but then they make them sick, but then they spread it to other people then. So they don't get no symptoms, but then still they spread it to other people then. So for let person pass meningitis, it can either be an asymptomatic carrier, or it be somebody who just don't get the sickness now, instead can pass on to people then. That asymptomatic carriage, they will not get when they show symptoms, but they spread them. Now, people are not bokuna, they want about 5 to 10% of the population get them, but now short term, almost if they can get them, but not for long term. Now, transient one, what we mean to say, they last long pandemic, but they can spread them to people, and then SSF no can say they get them. Now, that's make where somebody get meningitis, we can do contact tracing, where I will tell you later on under the public health management. So what are the signs and symptoms of meningitis? Well, as one I see from this diagram, there are different signs and symptoms in there. One way this one way they call say central, they affect the central nervous system, in the brain and the spinal cord. It cause headache. Meningitis they cause headache. So now I make sometimes in that case, people they get talk say that person an ordinary that he gets. Headache, where would they call it that? And normally we would refer to as ordinary. Anytime somebody get that now something cause them. Well, not for the call it that ordinary. When somebody get meningitis, they get severe headache. Headache now one of the symptoms the way they get. If they take paracetamol, sometimes no better. Then they can get altered mental status, which means in sense they become mixed up. They become, in sense they mix up. They correct. In mental in way of thinking, understanding things, then they become affected. Where it gets meningitis. Then in years it can affect in years. Sometimes some people can get tough, they come out the ears, or infection self they show inside the ears, so it get an ear skin red. It can affect the muscle them, it can get muscle tiredness, it can become very, very tired, muscle fatigue and severe muscle pain, it can cause people them. Then they can afraid light. Medical term we call them photophobia. But what it means is that the person will afraid light. If you turn light on at the room with it, will tell you say no, I don't want the light. It will always tell you say no want light. Then we get the systemic one, the way the person will get fever. Obviously, your body go warm, you will get fever. Then they will begin convulse on 10 and day, then they get convulsion. You see the person begin convulse, they get fit, what they call fit. They can get them. They can get neck stiffness, especially if you want for bending neck, for laying chin, touching chest, like what they do so. The person will feel severe pain at the neck. They can get stomach symptoms, the way they can vomit or they feel for vomit. Obviously, it can cause skin rash, as when they see this and as when they see on this diagram now, the person gets skin rash all over your body. Meningitis can cause them. So when you then now with person who is sick or you feel sick, you see say they get headache that way very severe. Think the way for the lookout for headache when a sudden onset of headache, we just begin number one thing from nowhere yet begin at you. You know to possibly known for get headache. Even if you known for get headache, you get some kind of headache, they wouldn't call migraine, way people in suffer from. But if you know the difference between E and this one can go if you get headache with fever, or you get that neck stiffness day, or you see somebody where you say an afraid light, you suspect meningitis, you for seek medical help immediately. So then pointers here, then signs and symptoms here, for remember them. For saying that then can show say somebody suspected say he gets meningitis. Obviously now a medical professional will go confirm the diagnosis, but when you as somebody now also whether now you begin or you relative, you say you see say you neck is stiff, you get this fever, you get headache, severe headache with all the symptoms here. You for seek immediate medical attention. These are pointers the way for the look for. Neck stiffness, headache, fever, for the look for them. For meningitis for the suspector. And the rash. Most time the rash can begin from the leg, they go up in the body. Then kind rash and they for keep an eye on them, for report them immediately. So from picking them, when picking and get meningitis or meningococcal septicemia, we get certain things they will for look for. See this picking at the diagram, you get rash, but because not dark skin picking, a black picking, sometimes the rash is not easy for them even spot and quick. But if you look under the foot or the hand, then you can see like this wire where this under the foot. But the dark skin picking can difficult for see the rash. Most time the rash can come up on the foot as they say they claim up on the body. So then kind rash they can picking them way then they not in the way for the look for. We get this diagram here we call symptom checker. With the look where you get your picking, you see say the picking temperature and body the warm. Sometimes they get the paracetamol where they belong you say for give picking. They help with the fever. The fever just to continue to go up. Then we get something we call medical term they call them they say tense or bulging soft spot. African people can call and say the picking get pleated. One I can see how baby picking they get some kind of shape in an area, then call and say get pleated. And the medical term are fontanelle. You get anterior and posterior one. Then they can bulge to your open big. You see a very prominent one. I hope you can get meningitis. You can see that thing this way really bulgy, they stand out. When that they happen, not can say the pikin get pleated. Or go begin, they can go begin opting and they for say the pikin, the pleated go lock. It can be sign of meningitis. And can get skin rash, and then body. Then the pikin can be very sleepy. For wake up, self, you know, easy. You try for wake up, you just a sleep. You go they blow fast. Then they shiver, then they shake. They see the pikin, they shake, you know, in body go don't want to they shake. Then something and they can just jack na your hand. We're not in the controller, in body can just jack, it get them jacking movements then uncontrollably. Then they say from a pointer for show you say this pikin has need for seek medical attention. In hand and foot they can cold. If you touch in hand and foot, you can feel and say really cold. Sometimes and then the pikin can vomit, then they refuse for it. Sometimes pikin don't use for it, you don't see lost appetite, you know, once if you get bobby self, you know, want the bobby. Then they can get a rash all over your body. See, we call them pinprick rash. See this diagram here, they show now the pikin get rash. Then the pikin can become very irritable. Small thing, you don't cry. Pikin use for play, small things until you hold and say if you cry. See. Then it can begin, it can get pain back. Pain, it can get joint pain then. Then the pikin can they pull some kind of sound where unusual. They go to see something, the pinny, they grumble, they pull sound the way you know for say this pikin is very unusual for this kind of sound. Then sometimes and the pikin can get one belly can one in the toilet fast. So all them pointers here, nothing the way for you as Kombra, if you get pikin or you look after any pikin, where they like care, you see get any of them wire so some, if not all go present, and then some of the normal go date, and then not all. You for seek medical attention immediately with that pikin day. No waste time at all. No waste time. And for seek medical attention immediately. So what are the risk factors then? Where they make person there at risk for get meningitis? Well, although anybody can get meningitis, as I've been saying earlier, big person, pikin, old person, young, man, anybody can get meningitis. But young pikin them, now they're more at risk compared to other people then. So young pikin them, then they're at high risk for develop meningococcus, pneumococcus, and Haemophilus influenza meningitis, when are different types of bacteria then. Today we'll focus on this one. Newborn baby then, they can get meningitis when a group B streptococcus they cause one kind of bacteria, what they call group B streptococcus. Adolescents or young adults then they have particular risk of meningococcal disease when we talk about today. You get the elderly people then they have particular risk of pneumococcal when another bacteria where they cause them, but they can still get meningococcal one when we talk about today. People who they work on a farm and other people who they work with animal then they have increased risk of one infection what they call listeria. And this listeria infection, one bacteria what they call listeria monocytogenes, and they cause that. Insect can go affect the brain, it cause meningitis. So if you work on a farm, if you work with animals, then you at risk for develop this infection and it can lead to meningitis. People who get immune problem where they soldier man in their body, they work fine because they get other medical condition like a HIV infection. People who they get some deficiencies, the way they make the immune system go down, the soldier man then at the body where they fight for them go down. Then the risk factors for getting meningococcal disease. Then also people who they smoke, active smokers or passive smoker. Where they smoke actively means you actually hold the cigarette, you smoker. And then an active smoker. Then the other one are passive smokers, are people where they smell, where they smoke, where they smell the cigarette from without the smoker. You know the smoker, but the person smoking the inhaler. So then are passive smokers. And then say them people in this they at risk for develop meningitis. They may do a study one time where they notice among students, the passive and active smokers, they all be there at risk for develop meningitis. People who find themselves in a sub-Saharan African country, we fall within the meningitis belt, what they show earlier. We run from Senegal and West Africa to Ethiopia and East Africa. All in countries, they did 21 countries in day. They all, if you didn't have them country, then they put you at risk for get meningitis, for get meningitis. And the one we more common they are the meningococcal and the pneumococcal one, and common in the area than they. Then they say you get higher risk when people the way they live close together. Like people away in a refugee camp, people away they go Hajj. If you go Hajj, they will plan for go Hajj this year. Or you know somebody they go Hajj. You're at high risk for you go contract meningitis at that Hajj place because of the closeness and the crowding, overcrowding where they do. People away they live in an overcrowded household. So until one going 2-bedroom, you go see like 15, 20 people and they live there. So until 3-bedroom, 25 people and they live there. People away they live in an overcrowded side. Then some they at risk. Because then if one person gets them, it can easily pass on to the other person. Students in the university, where they share the same dormitory, then inside the same room or inside the same halls of residence, they live in the same dormitory, then they say they are at risk because if one person gets an inside it will easily spread onto other people. Military, soldier, the way they then camp. And people the way they work, some people in this on job, the way they do, they put them at risk. They all they at risk, all they want are risk factors for they get meningitis or meningococcal disease. So this is a diagram of Hajj. You see the Hajj pilgrimage where they on the left, where people in the go Hajj now, so they can get close to each other, one another. You see the closeness where they do. If somebody gets meningococcal disease or people get meningococcal disease or meningitis now, yeah, when they cough and sneeze, because of the closeness, other people over there around them, they all go inhale that bacteria. And if you're not protected for them, you don't at least you can take and go to your country. Now that can make sure sometimes and those people can come on Hajj, touch wood, you can just hear it and say, oh, that person they just come on Hajj or I don't pass away. They know you can know it in the one. Sometimes they can be saying, yeah, so not all the time you can be saying, yeah, but sometimes they can be saying, when the Hajj, you don't go take something, you know, where you don't bring come away, you don't know. See? Then you see student them, the closeness within a university. Because then they can't close together. And now university, people they come from all over the world. All over the world or all over the country. Then they can't university, you know, they can't meet up closeness day. So if somebody gets, if you're an asymptomatic carrier, then you the way you're not protected, you can get infected by that person day. So now I make overcrowding place and then student side and really sideway and risk factor for meningitis. I will go for talk later on, but how for prevent, waiting they recommend for prevent in terms of prevention for this group of people. So how for diagnose meningitis? Well, when you suspect meningitis, as I been say, seek medical attention. Quickly, create the person go hospital. If I go immediately in a hospital, not to tell the joke or delay. When you carry the person go, the doctor, the first way they do now history they take from you. Before the doctor do all what you put here, so now history taking it. And they ask you what happened. If you're not able to talk, if you're well enough for talk, you're asking relative or picking, you're asking relative. What in do you go tell the doctor how the thing starts, how your symptoms, everything. Doctor don't do with that. Then you go do something called physical examination. You go examine you, the patient. And during that time, they see what in the happen. We go something called signs of meningeal irritation. See this picking here, where in body just jack so. This movement where the system not picking the door. Now it happen involuntarily by the muscle and the stiff so where the picking get meningitis now this. So one sign where the doctor see this, it make it become highly suspicious if this picking sometimes meningitis he gets because of this. See how the picking body turn over so. Now the muscle and they happen so then they do we not to the picking the door. Then it can do something, doctor will also do something they call canic sign. It assess for canic sign. It will let the patient, make the patient lay down in back, then flex it, then will bend the knee. Then the doctor will either try to treat the knee or tell the patient for treat her. Then he will observe and see if the patient they feel pain. Sometimes the patient can so feel pain at the back or behind the leg here that you know them for even acing foot for himself. And if the doctor ace for him, the patient will feel the pain. So once that happens, then we'll talk to that test stay positive. So the doctor they also go suspicious to say, this something meningitis again because of this test positive. Then we get the other test what they call Bondiskin sign. In your own, what in the doctor they do, they will try for bend the patient in aid kind size so the kind of the scene I so you see. Once you do that day, automatically you do this part of the leg, the patient in leg, they bend up involuntarily when not to the patient they do home. Then they again, if that happened, that means to say a positive test around it. Then they said they give the doctor high suspicion for say this something meningitis he gets. Then the doctor will look at the eye, he will look inside the patient in the eye for see, watch through where the instrument when they will use for look for see the optic nerve, then find the nerve there where they begin. They go look inside the patient in yes for see if you know tough, not the commodity, if you know red, all anything and they then you go do blood test. The doctor will order blood test. Where you suspect meningitis, you will order blood test for like and check for the bacteria how they cause meningitis. The other thing the doctor will do, they call a lumbar puncture. Behind the back, them vertebrae where they call the backbone them bone where they want from the neck take down to the waist bone. Inside the fluid they where they call spinal fluid. Now in the needle they go inside and they see so the doctor they draw the fluid. That fluid they say they send on a lab for go test and for see if germs they what they cause this meningitis. That fluid they under normal circumstances is supposed to be clear, not for cloudy. Sometimes the way infection it can cloudy, sometimes this one it can get blood stain pan and self, sometimes when they can go to lab now, they go test them, they will see if the bacteria or virus or fungi or whatever they suspect whether it's inside it. And sometimes they can do this test what they call electroencephalograph, where we don't talk about where I think one of the previous presentation they will talk about where they look at the electrical conducting system in the brain for see. Then sometimes the doctor can say, okay, let's do MRI scan for scan the brain and see what's happening inside. So it's very important for let person go hospital where they go check all things here. So let the doctor go assess you and try for confirm the diagnosis and treat you quickly. Other way they will the diagnosis, I will call them tumbler test. This one person at self can do one for yourself. Where you suspect say meningitis, you take glass cup, you put them against the rash if the person get rash, and then you see what's in there happen. See, now this diagram on the right, then tell you how for do one. When you put the glass cup on the rash, if the rash is clear against the glass cup, like what they put on, so you see the rash, they see them. If through the glass, the rash not change at all, and not change, it just remain the same. They say, likely, you know, if the rash does not change color, yeah, it not change color, it be the same, you see. That one day, you for immediately go see doctor, one day. If you not change color, you for see doctor. Then this one I also, you see, when them put on the rash, it disappear. You know, they see and say, if you don't change, you hardly see them. Then say, it go unlikely say that meningitis because the rash don't lose. But you know, for tap, every hour, if they do them, for they see something, because sometimes they can change. Not do a number one, no more, say, the rash don't disappear. This not to meningitis again. If I be meningitis rash, I for be still see under they not for be make no changes. They say do every hour because sometimes they waiting they happen. The rash not appear quick safe. Now later on by the sickness, now the rash will come. But if the person get rash, you suspect and you want for try for see, you can do the tumbler test now also. Then you rush carry the person to hospital or immediately when you don't see, you don't get high suspicion. Sometimes this sometimes not necessarily say for do this tumbler test for rush the person immediately. But this now another way we can do one. Doctor the SSS can do one way can reach me to the hospital, the SSS can do one. So now, what's in the treatment now for treatment meningitis? As I've been saying not to team way population, now medical emergency. Anytime we suspect say somebody get meningitis, whether now us on a medical on a doctor, they always for be very urgent, treat and urgent in a medical emergency. Now, prompt action now for take. If you suspect say somebody get meningococcal disease, now for contact the doctor immediately. Not go to that pharmacy where they around the corner. Not go to that nurse where they up the road. This now hospital them for treat them. Not to pharmacy treatment, this, not to nurse area treatment, this if you go to hospital immediately. Because waiting to some of them people here, they can so sick that as I talk, inside 24 hours, they can deteriorate, then condition can get worse and they can die. In need for get intravenous antibiotic when an injection when they go put inside vein. That antibiotic they kill the germs, then we go don't cause the sickness. So you need for then a hospital to a doctor who side they will treat you and give you the proper treatment. Most time, then this kind of sickness, they can manage an intensive care. Sometimes the person can so sick an intensive care at the end of, who side they need more intensive management. Where you know go on ordinary ward, so you go get for good intensive care. Who side need more monitoring, constant monitoring. Now that make it very important where you suspect meningitis. Go hospital. No go na then, no go safe na clinic where you know say they will get for send you back go na big hospital. Care and go na the big hospital. Who side you know for say you will get more care there. Because then small clinic, then can always refer you back to the big hospital. So for we so where in country the way they develop, you know, like Salon, so and other country the way they develop, care and go to big hospital, who say you know for say you go get more care. No care and go to the clinic. Once you don't suspect, now make they raise them awareness and for you go know waiting for look for. So if you suspect say this is meningitis, not to just order a sick no more. You care and go straight to the big hospital, so you know so you get the care where you need. Then sometimes they can get. We got what we call fluid management. So if the person you don't lose water don't in body because of that fever, so you don't vomit, you don't toilet, but cool the car be shown up picking there. You go lost water in body, they need for replace that water the way don't lose. So now I make it supposed for care and go hospital, let them do all that. And the earlier you treat the person, you suspect meningitis, you treat the person, the better it will be for the person in recovery. So do you anybody then I ask what they listen? I wonder when I know say meningitis na a medical emergency we can for treatment. Not for care and go at all to that nurse around the corner or that pharmacy up the road. If for care and go hospital because it need for get injection inside vein. And then injection in a hospital and they get outside and they monitor the person. We get something we call intracranial, increased intracranial pressure. When somebody get meningitis, you can get pressure inside the skull. The skull, the pressure inside the skull is so high that the person, they become ill more. And that pressure they can cause by either the brain don't swell up or something fluid inside it. So when that they happen, you go see the person headache dey increase, they get severe headache. The person can become confused. If they breathe, they breathe normally, how it's supposed to breathe. Sometimes they can feel safe for say they want for vomit. Then the blood pressure can go up. So when that happen, a serious condition, this they go for treat them very urgently. They need for treat this pressure inside the brain. Where on the right side of this slide, I don't go too much into. These are more doctors in our hospital more understand this more. But they can give them this drip they call mannitol, where actually they help for reduce the pressure with other things and combine. When they all list like so this condition self now another serious condition where meningitis can cause where increase intracranial pressure. The need for reduce that pressure. When that they happen, a very serious condition. So what are the complications and where person will get where you get meningitis? Well, you get two different stages. You get immediate complications, then you get the delayed complications. So on this left side of this slide, you see all the immediate complications that can happen. The person can go into coma. Women say they become unconscious, they know anything. Then it can lose in airway reflex system. What I mean by that is when me and you this so we conscious, we're not unconscious with it. I able cough, I able sneeze, I able swallow, me saliva, me pit na me mouth. That means to say they maintain me airway reflex system. Me airway no go block when at the windpipe, when I the air with blow. Say if that windpipe if it block, no problem. So when somebody get meningitis we're unconscious, they for maintain that. Sometimes in the past you will see them put something at the mouth and they intubate the person for keeping airway open, for making no go choke, sometimes tongue fall back or blocking airway killer. They can get fit, they can convulse, they can get fit, people when get meningitis. They can get something called cerebral edema, the brain can swell. Other thing they will call vasomotor collapse. We get a center at the brain, we get responsible for the vasomotor center at the brain. It can collapse, it can get problems, sometimes they can cause shock safe, whole system. Then we get something called DIC, which stand for disseminated intravascular coagulation, I stand for. It means a clotting disorder. Either the person they bleed continuously, or a blood clot will form different small clots inside the blood vessel. So this can happen in meningitis complication. The person can get respiratory arrest, they're not going to blow. They can get dehydration, which means they will lose water go down at the body pass, they need for replace that fluid there. Then can also develop something called pericardial effusion, where at the heart, the outer covering of the heart, fluid can go settle under the heart self can be affected by this meningitis. Then eventually the person will die. Or to all them complications, or some of them complications, the person will say the person can die. Then the delayed complication and how they happen, you can get something called seizure disorder. It means every now and then the person will get fit. You will get fit, wait till get them back, repeated fit now you will get. Or they get focal paralysis where part of their body go paralyzed, either one part paralyzed or one part of the face go paralyzed. They can get something called subdural effusion when now so under the brain, some layers of the covering of the brain, they get fluid under the hydrocephalus, when fluid in the brain, then this can happen. Intellectual deficit, the person in sense of understanding can reduce. They get sense better again, like I even did before. Then we get something called SNHL, when a sensory neural hearing loss. It can make they can get deafness. Sometimes the middle ear of the ears in hearing they become affected. All this meningitis na the cause. They can get ataxia, women they're able for controlling balance. They stagger away the waka. And so you don't well safe now one waka the stagger and let coordinate better with the waka. It can lead to blindness and can lose their eyesight. Some people can get what we call bilateral adrenal hemorrhage. On top of the kidneys, and also get two kidneys, we get one gland wasted on top each kidney, what they call the adrenal gland. Then can they bleed? Then two glands, and they all can bleed. Then again, die, the person can die. So this is a very serious condition. I make enough for joke with her. As you see, you don't suspect meningitis, go hospital immediately before they reach the stage where they cause all of this problem. Okay, today we'll talk about meningococcal meningitis, but I'll say we can just tell on alone and know what's the complication of meningococcal septicemia, what I've been talking earlier on, when the poisoning of the whole system. When somebody gets the septicemia part of them, they get something called gangrene, which means a tissue then they lost blood supply. And most time it come up on the hand, then the foot, the finger, and the toes then. And not me saying the other organ inside the body, they get gangrene. You don't see this fire, so you see the person, now internal organ, I know black, so they don't lose blood supply. The reason we make person they get dent here when you get this blood poisoning type, Now, because when your body poison with, when the body don't poison with the infection, the body, they produce some toxins, they are toxic thing, they damage the blood vessels. Then poison, and they damage the blood vessels. Then they make blood supply, they cut off to the part of the organ where that blood vessel they supply. So now make sure you see, so but now the extremities and the hand and foot and can suffer because the body where they try for fat, that situation, they concentrate more on the vital organ, then very important organ, then the body, the big organ, and then the heart, the kidney, other side them. As a result, now the extremities, then the finger and foot and hand, then they suffer. I don't see this person, you know, and all on black, this part then cut and come out now. You don't lose blood supply. The same thing, look this foot, you don't go bad, you don't get blood supply again, and this organ. And then so I see this person, I end up losing leg safe, they end up cutting because of septicemia. So meningitis, meningococcal disease, any form of the septicemia form, the meningitis form, all now it cause for concern, a very serious condition. Then, where if you well safe, you will left with complication. Look, this person I don't heal, but you don't lose in one leg. And then people are themselves and they end up lost their limb. So now you for take very seriously. So how they prevent meningitis? Now, vaccination are one way for preventer. The other way for preventer and for contact trace, close contact them and give them antibiotic, where I will tell you later on. So these are the vaccines that were available, where WHO say available for meningitis. You get the monovalent meningococcal A vaccine and C, were recommended for picking up to the age of 1 year as routine vaccine. And when I see that they also give 2 to 11 months old, picking them for get 2 doses, 2 months between each dose. Then they can get followed by a booster after 1 year. So when you don't get 2 doses, then at least 2 months apart, then they can get another booster over 1 year for boost the system at the age of 1 year for boost the system. Then we get one we call combined hemophilus B and C. If you can get that one day, then you have 3 doses and they recommend for getting at 2 months, 4 months, and 6 months. Then again, at 12 to 15 months, then for getting booster with the boost the immunity of that for that vaccine day. Then the other one are A, C, Y, and W. But the other name they call an ACW. I just mean say they cover all the different types. I remember when we begin to talk and tell and say this bacteria there's 6 different strains them. When A, you get B, C, Y, X, and W. So you see, this meningitis when quadrivalent are 4 different kinds strain in the cover. They say this vaccine they don't license and for give picking them from the age of 2 to up to 55 years of age people there. This now so WHO say license for up to 55, but people over 55 self can take up because I know say country they will give people over 55 anyway. And then you can also give picking them from 9 to 23 months, they can give them 2 doses of the one other vaccine they will call pentavalent, when I mean 5CV. Where WHO now just last year, 2023, now they don't actually license them. They don't pre-qualify and say for use. And this vaccine here, because of this meningitis belt country, they want to tell on about us. WHO then advise a group, we don't say, make them begin use another meningitis country, then the meningitis belt country, then the sub-Saharan African country, where then they get high rate of meningitis. So they don't license and say let them begin use and the good thing about this one, I don't get now the X type. Before vaccine, no, they cover the X type of the 6 different type group them. But now we don't get now when A, C, W, X, and Y. So all the 5 different one they cover. And I mean, B no more, I will give separately. So once they begin using all over the world, they say it will be really good. They say this and they expect say this will really reduce the meningitis and burden all over the world. But they say later on this year, then they expect say they will license and for use to picking away less than 1 year of age. And they expect for that to happen by mid this year. Yes. So the one they try anyway, small in terms of trying for prevent meningitis. They also say picking away premature, when they born premature, when they not reach full-time 9-month picking. Then for make sure say they're all vaccinated at the appropriate age and according to the right vaccine where they forget for their own age where they born them. Then for make sure say they're vaccinated for let them protect them all from this meningitis. People that will get HIV when the immunity not too strong, or then get other condition, they will make the immunity go down. Then safe, then for also make sure say, regardless of the CD4 counts, like people that will get HIV, they can look at the viral load when are the amount of virus within their body, when I think we call CD4 count. Regardless of that, they then for give them meningococcal vaccine according to the routine schedule for protect them from meningitis because they get low immunity. Then so the man they know bokuna the system for fix for them, so then they put them at risk. Picking the way they 10 years of age on up to less to 25 years, including beginning where they go university for the first time. As I've been talking to university student and they're at least, if you don't have this call, you do university, or you get PQ, they go university, or PQ, they university. Make sure say it protected for ACWI. And make sure say it protected with ACWI for this meningococcal disease. When you get on this vaccine, it will protect it for the A type, the C type, the W type, and the Y type. We then type are common for university student. They also say people when I explain it people or people we get splenic dysfunction or when they get complement disorder. What in that mean? Some people they will get this organ we call spleen. Some people they don't get spleen, they don't pull the spleen common either because of sickness or something, and the accident, the spleen go bad, they pull them. Or sometimes the spleen they but you know they function fine. Let's say if spleen gets something for do to immunity. Then they get something they call complement disorder. We get some the way God make the system, we get some protein, the way na complement protein, the way they help with your body in terms of preventing us from sickness. If that is deficient by you can prone to all kind of infection. So people that we get all link problem, yeah. Then also picking an adults them. Then for make sure say they get Men B vaccine and Men ACWI vaccine for protect them, but it depends on the individual circumstance. So would I have a specialist doctor where they see them for assess and see if they need them vaccine and give them for protect them, because they get problem with their immunity. They don't know where they catch infection almost so easy. So meningococcal disease, either meningitis or septicemia, and one disease where they say prone to, I make them for make sure say them covered. People are where at occupational risk, where you work and put you at risk for getting. People are working in a lab, you know, laboratories and technician, you deal with sample the way likely will contain Neisseria meningitis vaccine. Bacteria. Like where doctor don't send the lab now, the sample in a lab, that's say it was spinal sample or the blood sample. That lab person where to go check them inside that because then for the play with them. I know they work in a lab, I don't know how they do it, but I'm not saying they spin the sample there. And so until they spin and so the thing they generate then droplets where you go inhale. Now make if you're a laboratory technician, what they recommend for say you forget meningococcal ACWI conjugate vaccine with Men B vaccine. And every 5 years, if they get booster for continue for the boost your immunity. People are where they travel, then they go travel, then backpackers, then no say backpackers, and people where they travel, and get all things put under them bag, then carry the bag under the back, then they go country to country, you know. Then they go and mingle with people all around. They're supposed for actually make sure so they themselves gets protected. People who they live and work with local people in a community. If you work with local people in a community, it means they interact with everybody. Closeness go. So you self therefore be protected for meningitis vaccine. Then they go Hajj pilgrimage. Now Saudi Arabia don't make a requirement before you land in the country. You for show them vaccination proof for say you don't vaccinated for the ACWI vaccine before you fly go Saudi Arabia. So if you didn't have this call, you plan to go Hajj or you know possible to go Hajj, make sure say the organization where they travel so now talk to them about this vaccination. I guess they don't put everything in place anyway, but just in case you know you're here and then talk about them, ask them. Say you understand, so you forget me an ACWI vaccine. I think say other vaccine there as well, not to just this one, but other vaccine and back they were recommended for people who they travel or people who they go work day, you know, doing the Hajj. So if you make sure so you get this vaccine, you don't need the certificate, so you will need the injection and the certificate for sure so you get them. So let somebody not just recommend to you, say, I will give the certificate, or you need the vaccine safe, then for vaccinate you. Then you get the proof of certificate for what you take for go as an entry requirement in Saudi Arabia. So Salon vaccination schedule and this, and look at to see what we get in terms of meningitis. This one, the way they list now, so and the only one where they see now, so we actually go cover with for bacterial meningitis. Now this HIV, what they call it, Haemophilus influenza B, one of the bacteria that we show on the slide, Haemophilus influenza DD. So if somebody don't get this, you don't protected for that Haemophilus influenza B, then pneumococcal meningitis, now one other meningitis we insect na bacterial meningitis, we Salon they vaccinate for Hib and pneumococcal. But Men ACWI, we recommended not a routine vaccine as Salon. Men B safe and not see an answer as routine vaccine. I don't know, so tell no get Men B as Salon waiting, but some country then get as routine vaccine. So Men ACWI, I believe say go there on private, you know, they as private, but not a routine. So for the routine immunization schedule for Salon, the only two meningitis type 1C they cover now pneumococcal and Haemophilus influenza B. Plus also MMR, I think say then they give measles. Don't know they call it MMR, they call it MR when a measles like rubella. Then they give them, I think, this measles. See, 9 months alone, they give measles. Where obviously it will protect you from measles meningitis. Because measles, if you get the meningitis one, when I have been listed for the viral meningitis thing. This is the UK meningitis schedule. You see, what in the UK at 8 weeks, then they give picking them 1 dose of MenB vaccine. 16 weeks, then they get another dose of MenB vaccine. Then at 1 year, then they get the booster. Then they give them Hib, Haemophilus influenza B and MenC. Then they give them booster at one year. Then 14 years of age, when I begin the way they school, when they go from 3, so they go like year 9, then they give them an HCWI from school. Now school nurse, then they go to school and then vaccinate them picking and also. Obviously, the picking and they get other vaccine them, but this one are the meningitis one and this way they talk. Again, at the UK, now other vaccine and this way then safe then they also prevent, they're not deep on that one, they were just talking just now, that slide was show, but then say they prevent. It gets something called 6-in-1, and from this 6-in-1, one of the bacteria they wake up another Haemophilus influenza B. So then they begin giving them, at 8 weeks, 12 weeks, 16 weeks, then when they each 1 year, they give them booster. They get the pneumococcal vaccine, when at 2 doses, and they offer picking their 12 weeks and 1 year, and a single dose offered for adult, the way they 65 years or over, then they give them pneumococcal vaccine for protect them from this pneumococcal bacteria. Then MMR vaccine, so they give picking them 1 year and also 3 years and 4 months, they give them second dose. Obviously, instead will protect them from the measles, they protect against measles, mumps, and rubella, but that also means that get measles meningitis, get mumps meningitis, because they don't protect you from the viral infection. So area they give the second dose of measles vaccine before 3 years. If they get beaucoup incidents of measles outbreak. Right now, we have measles outbreak in this country. And so areas on board, they're waiting the public health team, then so they don't go decide for give early. And no board was the way they give the second dose at 18 months. Yes, again, no board was the way they give us 24 months before the 3 years. So what in the public health management, where they say somebody get meningitis, what in public health then they do? The first thing for do is, if the meningitis is not notifiable infection at that country, they will give. Like we now so now England meningitis is not notifiable infection. The health professional where they suspect or where they diagnose the infection is supposed to inform the public health team. This means that they notify into public health. And the doctor they do it because they get statutory obligation for notified infectious disease when a notifiable disease, so that the public health team will take action for prevent further spread of the infection day. So once the health professional don't notify to public health, they do something we call contact tracing. Then they identify close contacts of the case. Because I've been on telling earlier, say, people are already in close proximity. Now they're supposed to be identified and contact traced and then offer the antibiotic. So people are already live in the same household as this person, then they share the same breathing space, then they live closely together. People already in a university, then they share the same dormitory, when they inside the same room. So then 2-3 people in the inside one room, and they share the same halls of residence, they share a kitchen, all in a day. Then set na close contact. People are in a intimate kissing contact. You one man, your husband, your boyfriend, girlfriend, when they get intimate kissing, not a kiss where they peck and a cheek or just a mouth. This is not intimate kissing, because obviously you're going to expose to the person's saliva, all in a day. So it's supposed to be a close contact. Somebody where they work in a hospital, when sometimes don't involve in the care of this person who is sick, when sometimes they suction the person or they intubate them. Suctioning, sometimes those people are unconscious, they bring fluid come out of their mouth. For let that fluid, they don't go back down and choke and block the airway. The nurse and doctor, they can suction them, they can take some machine where they can suction and let it suck. Doing that, and they can generate some aerosol way before say the bacteria will likely be in that air, the way they go. Inhale and then CSF, if then CSF no don't protect themselves properly. So then CSF can be identified as close contact. The ambulance people then we get for transport this person from host to hospital or from wherever they pick them to hospital. If they do any suctioning for this patient inside the ambulance, where they self no protected, sometimes the people are not saying a meningitis person get cannot suction and before now they find out. They're all for be identified as close contact. So you have to fit the contact definition. Then we see they meet the contact definition when I had to explain. So they will do risk assessment. What are the level of contact we get with this person? Now, one also now all day, or someone will say, no, I just meet a normal 2 minutes ago, I passed to say hi. No, then not to a close contact, and not a level of long contact, then for you qualify for contact definition. What are the date of contact? Because remember, I've been telling I said the incubation period now 4 days, but it can run between 2 to 10 days. So the duration of contact or the date of contact therefore fall within the incubation period. If somebody say, okay, I've been me and the person been okay, I've been go spend the night na that person dey was on the 15th of April, for example, but the person they're not diagnosed with meningitis, say till May 25, for example. The duration too long for them to be in contact where you could expose, you know. So they look all handy. Then once we don't identify or close contact them, we don't know say they meet the contact definition. We recommend, we not to read it wrong, public health, they recommend chemoprophylaxis when an antibiotic within 24 hours, that's when they do one at this country. Within 24 hours, where a case not be notified, when I don't identify and contact them, then contact them, they forget the antibiotic within 24 hours where they don't diagnose the patient or they don't suspect the diagnosis in the patient. People are waiting at the same household forget them. They all forget ciprofloxacin. We meet them where they don't identify now. University contact or whatever, they go then I will meet sometimes some people and go on school trips on site, then can be said they share the same room. Later when they return from the trip, they can say, oh, somebody don't get meningitis, you know, they're all for B close contact and forget chemoprophylaxis. Anybody get direct contact with the patient in secretion, why we don't talk earlier, either in spit or in saliva, such as in kissing partner or health professionals, and then say forget the chemoprophylaxis. So what do they recommend for chemoprophylaxis now? Ciprofloxacin as a single dose, 500 milligram I recommended for adults. Between then 250 milligram between the age of 5 to 12 years, and 125 milligram for picking them in 1 month to 4 years. This not a public health they prescribe, and public health they talk to the person doctor and recommend this for say the person don't become a close contact of somebody who gets meningococcal disease or meningitis, where it need this prophylaxis. Then vaccination for the case and close contacts. We don't know the type, because once the doctor they notify, public health not going to know at that stage they're waiting at the type, whether they have A type, B type, C type, W type, X type, or Y type the person gets. Now, when they don't send the sample now, the reference laboratory, in this country, they get reference laboratory in Manchester. When they send in Manchester reference lab, they count the confirmation, but say, indeed, that sample have been sent to me for this XY patients. Now meningitis W now see by the sample. Then when they come back to public health, they write back to the patient in the doctor and say, in family doctor when at the GP and say, this you patients will get meningitis. Then don't confirm and now say that meningitis W get. Then go send the copy of the result to the GP says, but sometimes public health can get her before the GP. So then you always contact the GP back and say, now you need to review the patient in vaccination history. Look if you're protected for meningitis W. If you're not protected, you need to make sure you're protected. And not only for the case, even the close contact themselves, who we not identify before, where they may not get chemoprophylaxis. Then for follow-up, they're all back. Make sure say then GP check the vaccination record and see if they're protected for that strain day of meningitis. If they're not protected, then they offer them the vaccine waiting for that kind of strain. And I make it very important contact tracing. Somebody get meningitis, you're supposed to contact tracing, close contact them. Get meningococcal septicemia, you're supposed to do them for close contact them. And do all of this waiting on the screen so for make sure so they protect people and let them not get another case. Because what will happen if you not do that? If the person will get the sick, we go don't pass on to that this person will sick. If it's still inside the family or inside that contact circle, party or whatever, the person goes another second case go come back inside it. I make the give all man the chemoprophylaxis. So if anybody where they win and they carrier, we get either and nose or in throat, that antibiotic they clear that carriage they come out from that person. So it's not going to go and spread the infection. Then again, they will reinforce the vaccination of the person. Even the person where they get the sick, the patient in the hospital, they can give himself chemoprophylaxis this for clear and common and throat, depending on whose antibiotic will they take for treater. If they treat with antibiotic when either ceftriaxone or cefotazine, where they fall under the cephalosporin group, them, and only they gain oral antibiotic for eradicate the carriage in throat or in nose, because then they don't cover that. So when doctor they notify, we can know whose medicine where they give the person. Follow know whether the person, in addition to that antibiotic, then we don't get IV. When it can't, even a person is unconscious, whether it need for letting get chemoprophylaxis for clear the carriage or not. So waiting at the WHO response, waiting WHO say for do. So WHO don't say, they don't get agreement, World Health Assembly don't get agreement with the one whole world for say by 2030, country they don't commit, say for the one pull promote bacterial meningitis as a problem at the world. By 2030, then they pull and come out, and make it get this X, then they eliminate them. They want pull and come out. Then they say by 2030, they will reduce the case of vaccine preventable bacterial meningitis by 50%. Then case the one will get all over the world for less by 50%. And the die, then for reduce die for meningitis by 70%. People are not for the die for man. Then for reduce that by 70%. Then they also want to reduce disability and improve quality of life for people where they survive. Sorry. If meningitis catch you, so if you get meningitis, you survive. Then they will survive, so they say they want to reduce disability and improve their quality of life. But how the world will achieve this? They need to do their action there on the right hand for them able to achieve this commitment by 2030. And what are the actions then? Prevention and epidemic control. All countries for focus on prevention and epidemic control, and then for they develop new vaccine them for try to prevent this meningitis for pull and come out. Diagnosis and treatment, therefore focus on speedy confirmation of meningitis and optimal treatment. When you suspect that somebody get meningitis, quick information, say quick while you're ready for diagnosis and begin getting the right treatment we need. Then for do waiting and called disease surveillance for guide meningitis prevention. Surveillance means continuous watchfulness of something. You keep an eye on something, see how the numbers and they come up or they go down. If you don't keep an eye on how you go know if the control measures the way you don't put in place they work. So you get for the continuously watch them, look at the trend of the disease, look at numbers, look at how many people in the get, look at the vaccine uptake, how much people in they take the vaccine, how much people in they get the sick, how much people in they die from the sick. For the continuously monitor that you can't you know if you public health action then they work or not. If they know they work, so you need to make some changes. Then you forget care and support for people away affected by meningitis. You focus on early recognition and improve access to care for anybody with meningitis affected, for able for recognize for say this na meningitis the person don't get quick allow do what you supposed to do for getting better life and for saving life. Then they say advocacy and engagement. All countries will make sure say they raise awareness for meningitis. People for know what's in a meningitis, they for know what in for look for. When you see a person sick, you see your neighbor sick, you see your pikin sick, you see your party sick, you for no say or the person say for no say these signs and symptoms why they see so. Now meningitis are the suspect. Make a run go hospital. So we for the raise awareness. But on a public health plan, we get for all countries for put awareness raising as part of for make them will make people aware and know waiting for do. So today this is the take-home message I get for we always I don't talk so now I don't summarize so now yeah. Meningococcal bacteria when a meningococcal disease. They say a bacterial meningitis. They say the most serious form, this meningococcal disease, when the bacterial or septicemia, the most serious form of meningitis. Within hours, it can kill you. The bacteria can kill a very deadly bacteria. We already tell now. It catch adults, it catch bikini, it catch woman, it catch man, it catch young people, old man. It pass through close contact. Through close contact now they pass. Then it can kill people in 10 to 14% of the cases. They can die. 11 to 19% them. Survivors, they can get permanent disability, even if they're well, they can suffer permanent disability. It can be like a hearing loss. Sometimes they can get brain damage. They can get loss of limbs, while already shown now, and other serious conditions. Then they say this now vaccine preventable disease. Vaccine they will prevent them. So make sure you're protected. If you don't know your meningitis vaccine status, check with the doctor. Let them check if you need them. If you need them, make sure you get them. Then they say early recognition and Beteh. Then recognize an early, then catch an early, say this is a vaccine and meningitis you can get help through medical and treatment, and then you can recover. So the CDC self recommend meningitis vaccine, saying that the best way for protect picking and adults them. So this now we take one message, and this now can bring me to the end of the presentation. Any questions? And after this question slide, we get all the references for now go refer back to. So that's all from me. Thank you so much for listening.
Thank you very, very, very much, Auntie Nafi. Me fumble them on the way you don't go into this, unfortunately, I missed some of you practice session. So a good say, myself don't learn for like everybody else for the first time. As other year, some of them and I think they way preventable. But that thing we I can always talk about how some of we culture and attitude get for change. That thing about not government. Sometimes we self get certain actions and activities that we self can do or take for help with any kind here. So thank you very much, Auntie Nafi. For me, anyways, for most of the things that we don't cover, the questions they will have been get, they all don't go out of the window. As I know, I can always get questions on the side where I can prepare for ask, just forget the ball rolling. But today I don't look at all the questions that I get. You don't cover All of them. So what I will say is I will go to the audience, last see who that get anything for ask. And low yegi for Muna. The car be don't show that before as to how una cable ask questions. If you ask question by raising your hand, raise your hand. If I see you, I will come to you. If I see you, I will come to you. And for the other way, Sabi type, you can go ahead and type, and I go look at which in you don't type and try to read them out. Anybody get any questions? Yeah, Mr. James. Is it Mr.? Yeah, there we go. James?
Yes.
Welcome, sir. How are you?
Can you hear me?
Yeah.
Good. What about you? Well, first of all, I want to say thank you to that was a good lesson. I learned a lot. A very important topic. But second, my question is, well, I won't say a question. Another thing again, just like we mentioned earlier on, sometimes for the region, most times when people travel, they return back here. I mean, say for example, they contact meningitis. They know we'll talk if you get for when you get for do the history, the family history or the trace. I mean, most times people know we'll talk say they travel. They'll just say they need to feel well. So if they know say you traveled, you know, just like I say, certain region, the Mali area, the other area, then they get a high contact of meningitis. A good sometimes where you mention, say you just travel come, that could speed up the process. Then they get for go through a lot of procedure for find out what it is. Then it's too late. So it's also good also for mention, say, hey, I just travel come, so and so time I come.
Thank you so much. Very good point. I can always say to people that when you travel, not to just hard yourself, any side you travel where you go, when you present our hospital after you return, always tell your doctor, say, I travel, I just come also so country. It will really help the doctors then for diagnose you. Because if you keep that information, they will eventually know, say, now this sick you get, but it will take them longer for get there. So if it's very important, thank you so much for bringing up that point. And they help as part of the diagnosis, you know, they make the doctor then actually think a lot and say, okay, if the person going to this country, no, then they look at the signs and symptoms, the way it presents with, you always quickly put one and two together for say, they suspect this infection because they don't go in a country where you get her. So that's a good point. Thank you.
Thank you very much. Somebody also says somebody passed away, we just come on Mecca. He complained that the next thing I die, you know, you're going to coma, and the next thing you know, you don't die. Now I don't know if he linked to this, but may it be, you know, the person where die may soul rest in peace. And to the community when I watch for burial. What I want to say is for the one that way they upline. Until if you waiting, you go. I know say you don't go into how they can able to do tests now, O's and stuff like that. From a prevention perspective, which you go ask them for do or advice. I know not to replace for tell government or Ministry of Health waiting for do, but waiting will be your advice as to how they can able to prevent this. And for the one they within a village, I'm talking about the village people more. Why do that village? If there's suspect then kind of and some of them not get big hospital near outside and day. Is there anything whatsoever they can able to do in the interim? You know, till they able to get that person there to a big hospital. So now two questions. One,
yeah.
Waiting at the advice where you go give, say now be me be responsible for roll out any prevention strategy in a salon. What's the advice you could give me? How for implement and say then suburb, then place the way to both say for let get the problem. Then two, if people and that then kind place, then they will not get big hospital near to them. Is there anything, I know it's not the best, but is there anything they could do? You know, if somebody gets then kind here or they suspect somebody getting kind here, is there anything they could do before they get onto a big hospital?
Good question. Thank you so much, Mr. Fuller. First of all, I tackle the first part first. Where you talk about what advice I will give to people then we probably like
say I mean the public health officer and I make responsible.
Talk to the public health officer.
Yes.
First of all, before you put anything in place, you need to do a need assessment. In public health, we call health need assessment. You need for assess and know what's in the need of the people in that village or the villages then. What's in the need? Is it awareness in the lack? Or is it transportation need like I talk and so? When you don't know these are the need assessments, then you put measures in place. If not awareness they lack, then they don't know what's in meningitis. You need for raise awareness in the language where they go here. So you probably go for include recruiting people where they go out in that village day, go sensitize the people of what's in meningitis and what you mean. Because you know, say in the villages, they get a new perception of things.
Yes, like somebody don't say just no enemy, maybe your sister, your cousin, or your rival, you know, and witch, you know, say we small to say, let's say a witch.
So it's really not easy. Therefore, sensitize and get awareness because in the villages they get a new perception. Most times they can talk say, "Oh, this that here." Then our family in granny been get that in great granny we been died today. They been get that, so they know they attribute to infectious disease. They always attribute to something, either witchcraft or something they want at the family. So you therefore raise awareness first for let them understand. Say, no, there is an infection called meningitis where you need for seek immediate medical help. Once that don't happen, how then they seek the immediate medical help? Like when you don't talk, say, so some villages do not get big hospital. Either transportation and a need for pulling common at a small village, they carry them go to the big hospital. If not, they need with the government for provide them for them. You know, for provide them for them, either in a form of whether a vehicle and go need or other form of improvised transportation inside the village they for no let them reach big hospital. But meningitis is not a thing where they treat in a house or inside a small clinic. You need for going to a big hospital where you get all the facilities then. So it will require a lot of work, not a 2-day work. You need assessments, then you identify the issues, you put your recommendations in place, and you work towards them.
Okay. Thank you very much. I know say don't stress on that side here about for let people and go, you know, in a big hospital. I just feel say no more. Maybe in the extreme situation, maybe there's something. But if I'm willing to do and this not something where you able patch now also if you know say maybe leaf go work for them and stuff. Ideally, now for not to say they say leaf not they work for. I'm just saying me no sabi about leaf, so I'm not able to recommend them. So the recommendation we me go take like the one they we don't learn but we understand how they work. The advice we then give is that let you go hospital and go seek medical advice as quick as possible. Any more questions?
Yeah.
Yes, Mr. James.
Also, you mentioned about since it's very contagious. Now, what about say for example, just like I mentioned about people, we don't know the medical, not understand the medical terms. Number two, I don't know. I mean, like when Ebola be happen, you know, people they know say the family they get Ebola, you're supposed to stay away from them. Some people say, no, I will ask that person, I will do this person. So since, I mean, are they going to train these people to understand, say, this is a very contagious disease or bacteria? You can't just, you get for isolate that person. Then also you get to sanitize if not the host, you get for sanitize them all the thing in the.
So just to understand the question, if somebody gets how you go educating family for say this is a contagious disease, you say go there at risk, but be careful when you go near the person. Is that what you mean? And that's what you mean?
Yes, that's one.
Well, first of all, I don't know if you remember what I talked in my presentation for say close contact them. When I either a contact or a household contact, and name the one they win a close contact. If somebody don't already be a close contact, I'm to say don't expose already. Right? You don't need for tell and say no can near the person again because you don't expose already from the person. So if they catch the bacteria, I don't already get them because the person don't actually expose them inside the same house. And I make with the contact trace there, forget them that antibiotic they want to talk about. They forget them the antibiotic because it can be say this person will get sick. If we don't get them for one point in contact them where you don't interact with inside the 7 days before the incubation period, inside the 7 days before you get symptoms. So in different from Ebola, right? Ebola, yes, you talk say no go near the person, no, because no touch him or anything in the because you get for touch the person or touching come in contact with him body fluid them for make you actually get with this one airborne droplets. You go don't inhale her anyway. If not kiss, you don't kiss the person like if you don't kiss her already, you don't exposed to his saliva already. So if you didn't have a hospital, you say you know they go near them. You know, you go get for put all when they isolate them, so doctor they can say wear your gloves, wear your mask, and what all you need for them for follow that and go inside. But you can't say, okay, I don't go near them because you are already in contact of this person. We're already exposed. So what you would try for doing for give you that antibiotic. If you know the source of an infection, you go clear that carriage day. And when the strain typing come, would they make sure say this person himself go to a doctor and check out if himself cover for that vaccine day. So yes, I agree with what you say, you know, in some infections, they will say no go near the person. But in the case of this meningitis or meningococcal, the close contact, they don't all get exposed anyway. That from themselves, the patient don't get out. No. Because we're not going to know how the patient gets out. The reason why then they give the antibiotic, not to for prevent them from letting them not get out no more. Now for letting them not continue for shape and back, because you will be saying that then at the source.
Okay. So my family, now the other thing this as well. It's about telling the truth. Sometimes we can be in a position where because of stigma we can feel ashamed for talk something. Sometimes they foretell the truth, you know, might save your life and even save the life of your whole family. So if you don't get in contact with somebody and this then kind of tear come up, it better for let you say exactly who's you be there, the people and way if you don't come, you know, if you don't come in contact with. And also when dentia becomes available for we take preventative measures, for example, say the vaccines and stuff. I know say there's a lot of what should I say? I don't want to say stigma, but there's a lot of misconceptions the way we get now Africa say they can't kill we. You know, I'm not going to go into the history of certain things that way don't happen in the past. However, without things than they now, you know, my advice is think that like this way now research will don't go on for years and stuff and they don't certify and say yes if it happen. My advice is take that prevention day, accept the vaccine then day for let you save your life and you begin your family life for tomorrow. Any more questions? Or any of the doctors they want to add something else? Dr. Ture, Dr. Kama, or Dr. Bell, maybe you want to add something from Mama and Pekin perspective?
Yeah, you hear me?
Yeah, you talk slow. You know, say you
hear me? No. Oh,
how are you, sir?
Fine. Nafi, thank you so much for this session, this presentation. It make it so crystal clear like glass, so nobody know able to ask any question because you don't
exactly.
answer all the questions there so far, right? So whatever we say, and I for just emphasize waiting you don't say, right? More importantly, this not to host treatment, host sickness. You know, the key thing I think TJ asked about the people with the upline, where they remotely from a main hospital, at least they must get healthcare somebody there. The key thing is if they suspect this condition based on the symptoms the way Nafi don't talk about, then suspect them, you know, the stiffness, the headache, and all that in there. You're not for waste time at all. The healthcare professional forgive the person antibiotics injection straight away, right? However, if forget the antibiotics injection, now struggle, you know, go say the wait stay in get the antibiotic injection before they transfer in the hospital. So which one come first? If going to the hospital now faster, now they then for go straight away. If going to the hospital they cause a delay, let them get the antibiotics injection straight away, provided you not get a reaction to the antibiotic. Normally in a penicillin. And the penicillin reaction, if I don't be an established penicillin reaction, not to somebody where they just get something no more vomit, antibiotics, vomit, say don't get penicillin, like not to that they mean. Because people in the misquote this penicillin allergy so much. We get established anaphylaxis from penicillin, 9 years, you will consider, say, an alternative. But if you then at that remote place there, you're a healthcare professional, somebody come with this thing, yeah, and for care and go straight away the injection them. All right. And the thing again we make this not to a backdoor treatment is when you go even at the hospital, it's difficult for them find the exact bug, bacteria, virus, whatever, TB, whatever cause them. It's difficult for them find out. That's one thing that they. So and then they give what they call initial blind therapy. The initial therapy, they call them blind therapy because a blind treatment then they give you first because they don't know what it causes. So all the antibiotics, IV, drip. So the possibility at the hospital, at the center they can meet you now, not embark on that drip the way they give no more CDC for better. I don't get all the drip them, you go fine. No, it doesn't end there. Right? Even when you give the drip, it might be say the drip where you give, the antibiotics where you give, the thing resistant to Rana 1. 2, it can be saying that the wrong one you treat. Okay, and the antibiotics need to kill a particular thing the way it can be Neisseria, it can be Listeria, it can be virus, it can be even cancer, it can be something else. So not just embark on that. So you, the healthcare professional, for the on your toes, every day visit this patient, see the changes, and the key person in the management, in the big hospital even, is the microbiologist. We know in our health system, everybody feels it knows so much. It knows so much. If you say don't get all the antibiotics there, if for better now. If the relative they can ask question now, we know they not for talk to you because now the Almighty God. You get for no say the treatment depend on then all the lumbar puncture that they do, take the CSF, go culture, then take the blood, then go culture. The reason why, they say going to the hospital are the best because one, it go don't do all them things and they don't take them sample and they where then send them go to the lab and if they don't get antibiotics already, sometimes they interfere with the outcome where the lab technician or the laboratory or the microbiologist can't tell you because they need for grow them, then they go up put all the medication in the inside and see which of the medication actually sensitive and they kill this bug, what this bug sensitive to and which are already resistant to. So if you don't already get the medication, it is difficult for the lab people and for find out which exact medication they kill this bug. Yeah. I hope that it makes sense now. So which is why going to the hospital, when you're not the healthcare professional, they mention meningitis. Everybody they do on it too. Not to say no more, mina almighty doctors, I be all tina. You understand? You get for work with even the nurse them, even the cleaner safe na the place. You get because they're all important in managing this meningitis patient because they die like that in few seconds. So if the people where they not they take the person go to hospital, then pass and go to 2-3 places then first. Go get whatever concoction they want for give the person. By the time it come, the thing don't already to make don't come up from the meninges. It don't go na the brain itself now it come encephalo, many go encephalitis. Yeah. So and sometimes when they reach based on the protocol of the hospital, then they straight away give them steroid and it depends on the age of the person. The prognosis, the outcome depend on how fast you go, then treat this person and the age of the person and the complication where they get. So this now a message where I know I so much emphasize on them because the healthcare system now is based on one person feels say it do everything, it's a be everything. You have to liaise with your colleagues. Sometimes we get complication, you liaise with other people, subspecialists, and liaise with the microbiologist. Now, you actually get for taste this one don't cancel the virus. And the good news about the virus is that most people in the recover, maybe within 10 days, then they recover. And sometimes in a supportive management, what we call supportive management, you make sure you get good fluid, overload out fluid, good hydration, and all them things, and the fever, pain, you control them. Supportive management. And if you suspect the kind virus, say hepatic virus, for instance, you can give a cyclovir IV. Or if not cytomegalovirus, you will give ganciclovir, some of them viral medication you can give them. We can help the person for recover, right? But the bacterial meningitis is dangerous. Neisseria meningitis dangerous, pneumococcal meningitis dangerous. So especially we Black, that rash, not to all tell like you mentioned it, that very happy we mentioned, and they know they always they see them. So if you get somebody picking, no more pick, picking the cry headache. But if you picking the cry headache, the light, the kind, the monarch, say, oh, turn the light off, you get for no say this one, no go take into that nurse corner and that. You really know so then they can meet safe. You get for no say, let no waste time for this. Yeah, you injection them, but advise the person. In the person you're interested, let go to the hospital. And we're going to the hospital safe, let the hospital specialist then work in coordination. Right? And they work in coordination with them, colleagues them, and also they know say this patient where they can meet them, so they get family them. They're anxious and they worry. Let them able to explain to them how far then they in the treatment, then they work in coordination. Not to say when they can say, hey doctor, what's happening? People say, ask me beaucoup question, no ask me this, no. You get to explain to them because they worry. Because that one grand person is na the key person for your family. Or that picking the na the only picking for your family. So they worry. So you need for know I for talk to them, tell them say, this na so we suspect. And now this so we they do first. Let we say how this come, and then when we don't get result, we go to the next stage. You tell the people and waiting to happen. Then then they tell una not say, this doctor, I just say waste time, you just say ask for investigation no more. Lord take a little can go to Pabu Konayanda. Go just go get this thing here tomorrow I begin waka. You will kill her more. Because once you na left I begin go to DIC, they begin get other complication there, then it done. You see, so I'll stop so for now. There's so much to say, but and this way you don't talk to in just 45 minutes or 1 hour in a whole day. It is very important now. As you suspect them, even in the primary care, straight away you know they waste time with the person itself. Now straight away they call ambulance. We call ambulance and they by stages. We call her before the next 5 minutes. The ambulance to reach for care.
Yes.
I will stop so for now.
Thank
you very much. What? If I not be the figure before, if I not be the take serious before, I had to. Dr. Bell, you know, say you had the count tonight, Mama, so if one of the things where I want to touch on is, say way Mama they carry picking, all that picking in health and wherever like that depend on the Mama. So if the Mama gets them, what happens?
Yeah, if you want to get
I don't think it could be a whole topic on you, but just kind of give we
yes, it depends. It also depends on the stage of the pregnancy. But now, very risky pregnancy if the mama gets them. The probability, especially for that bacterial meningitis, when they talk about, the risk to the mama and the risk to the pikin. And I make waiting if we don't talk, waiting doctor to we don't talk is very important for make they able for rush the mama go straight to hospital. And a good say the medicine where they can give the ciprofloxacin, for instance, or even penicillin, you can also give pregnant woman as well. And even the vaccines, if we have the vaccine, they say you can give the pregnant women. They not see any problem for the pregnant women that vaccine there at the moment. So for this one as we know, so okay, it's very, very a good say you forget the vaccine, you forget the treatment. And we know a lot of women in a way we get that meningitis, they can lost in pregnancy, or even the pikin self can get disability if the mama and pikin survive. But the probability for the mama and pikin survive also very, very low, unfortunately, because of the gravity of the sickness. But waiting, Nafi, thank you very much for this session. It's very educative, and people are going to feel say, we get other important sick like malaria. Waiting they can talk about meningitis, but the thing where we know now, well, Bodi Beteh Patch Gentri is that each and every sickness important. Even if we feel so, this year, so if we didn't have a small village, as that person not being get that today, how you do for Krangon hospital, the person don't die second in the next 2 days. Why make we talk about this? Let's talk about malaria. No, it's very, very important because of awareness.
each and every person aware say this thing day, and somebody go day in a salon, we will get them. I mean, if you don't talk on 1,400 people, I mean, that's a lot, you know, for that small country, you know. So a nice way to talk about them, so-called seldom, we refuse to seldom, but it's not seldom. We talk about it as well, you know. But as from my own side, for the gynecological side, yes, it's very, very important for making mama and picking and the mama be treated for save the picking in life as well.
Wow.
Thank you.
Humble them. I hear you. I
Since
think-
you are the one thing
What
for
happened in our school and say spirit pass, and there was a yin. All my quiet. Anybody else get anything else for that? Yes, Auntie Nafi.
I just want to add no more. I just want to say, I know of 2 deaths where happen at salon when are very young people. In fact, one very recently, somebody below the age of 25, he sadly passed away as soon as he began university. So he complained of headache, till he died, he complained of headache. I don't know if they end up diagnosing, but when I talk to a relative, I really highly, and with my own experience, I say, this is sound like meningitis. But again, as soon as I complaining, that, they eventually can't go hospital. But in arrive one hospital and in die one, all just join together. As they reach, they die. So now I make it very important. Let them care go the person go hospital immediately. Just like how Dr. Today and Dr. Beldon say. Thank you.
Okay. We fumble them. Uncle Doc, you want to add anything? Because we can round up now. We don't need run out of time. I know say with the end on a downer.
Yeah, I'm glad you say.
Yes, sir.
A huge thanks to Aja Nafi. He, as you say, he actually do this talk justice because now big topic this, and for able to go through in the time and the pace and cover all which you don't cover. So it's absolutely, you know, much respect to him and thank you so much for that. But I just want to draw people's attention. We big professor amongst we. Professor Lisk, thank you so much. Hats off to you, sir.
Where are
Yeah.
I don't see
Prof Lisk there.
Oh yeah, I don't see her. Hello, sir.
Yeah.
How are you?
I'm so happy because this particular topic just go right into it.
I'm good. It was a very good delivery. Thank you very much.
Thank you so much, sir.
Thank you very much, sir.
Thank
I mean, let's say we could
Thank
give
you.
word. You know, it's really good. A nice fellow we hear from because the topic we deal with just before we break up for Ramadan, na epilepsy. And this particular topic, you find where we go, you know, after that, it really just, you know, strengthen. It really go into the fact, say, they seek here, not to seek for play with in terms of when you arrive. Like I made the talk on so 10-year average between the time when the person get the first symptom to the time where they go diagnosis of epilepsy. Well, this one now, 10 years, that day when I die, that day you don't die, how much 100 years. But this one is so important because it's time critical. So if you're in a remote area where nothing not there, like how Dr. Today talk about, that injection, if you're able to get them, then they go buy you some time. You know, if not, then of course, if you knew the more important thing to do is how forget this person to also if go. Like how I feel talk the poor man, possibly there's something else he would have. But if they complain of in here, then as they reach now, nine that the brain does well, enable for maintain them, nine that not die. That's the thing what they talk about. We need for do things in a timely manner. Not to begin with them say, oh, make a like you paracetamol first, which is this person get temperature, it tells him in neck the heart, it tells him I know and look the bright light. You know, he knows the wrong, you get temperature, you hit the heart, you hide the red, all the thing then they. Sometimes you did in college, sometimes you did university, or sometimes you just come on Hajj camp. Now, one thing we talk about Hajj, not to just Hajj, Umrah stuff. Anybody will go to that place, we get for members say, then get their own COVID. He still did it. Now that then called MERS, MERS. Now COVID done it. It can present similarly to the meningitis. Very important for levels. So when you go into the place where they could treat you, then could definitely distinguish one for the other. Because as you come, you tell them, say, I don't come out Saudi Arabia, I don't come out Qatar, I don't come out Kuwait. The first thing they go do, they go put you in a special room where you want in there. Then they go begin pull the blood them, they go begin then get in contact with the infectious diseases specialists. So we now in Manchester, now North Manchester get down there. We'll send to them, they straight away go begin tell you what you for do, they can't test them for do. And I tell you what, we need not forget say virus self can cause that, like Aja and Vitoka. The difficulty here is when picking come, we always do that. We gear against the virus, we gear against the bacteria. Yeah. But important for remember say the young adult themselves. Like I talk no more dormitory. Then the way they go in a college and they in that place where they share, room, contain them 4 days in a room, and they in that campus day. Now they nothing they can break out. So all that thing and they nothing they will get for be aware of. And I make it important for they do them talk here. Because what we do, we they create the awareness. We they make people remember say, not to forget to power bone at the corner. No, it's not secret time critical because it is swell the brain and it kill a jibo. As we know, it's alone number 7 in the world. They just tell you number say we need to do well at all. So therefore, the more we sensitize people, the more we make people aware, the more likely say we will save their lives. And what we do for well body? Well, I say we save lives. In way do we. So I'm glad they say Prof Day with we, and he really don't help with the epilepsy. And now we go to meningitis. It's absolutely vital for people to carry on with that. So I'm not gonna go too much because they don't talk everything. Aja and Afi don't left me without anything for say. I'm so glad well, thank you so much. Remember, say well body better pass Gentri. Thank you so much.
Thank you very much, Dr. Kama.
TJ, somebody say put your hand up. Somebody in the chat when him claim say he be had a hand up. I don't know if he's still there on the call.
Okay, let's just check. I don't see anybody on the up.
No, he said I think they try for tell me say he don't put your hand up. So tell ask question. Call and claim.
Hold on, please. If you put your hand up again, please, that's you. I beg. Because just they're about to wrap up.
Clem Snyder. That's the name.
Yeah, Clem Snyder. Yeah.
Can I try for unmute him, please? If you see him.
I don't know if he's still on whether I don't go up or
Clem.
Okay, thank you so much.
Yeah, don't come on, yeah.
Okay.
Yeah.
Actually, they don't cover most of the things I'm around for actually talk. I would say it was a very well comprehensive presentation. So much is not there. But the only thing I really wanted to focus on is make the healthcare provider another mix up the difference between a bacterial meningitis and a viral, because if the patient presents himself, you give antibiotics and a viral infection you get, you're just really wasting your time. You see what I'm saying? Now, also, there are simple things that you can actually do. You not get for a wait. I think somebody mentioned about the patient already don't begin to take antibiotics, we can probably mask the microbiology skin findings. If they do a simple spinal tap, you can look the condition of the CSF, whether it is anthrochromic, that's looking yellow, whether it's bloody, or you have other things there that you can make an immediate conclusion of how you go about treating this. Also, there are some tests that you can do to see whether it's an inflammation based or whatever. For example, you can do a CRP, or you can do a simple test. For example, if you not get all the accoutrements to do all the tests, you can do a simple test like a saturate, which just whatever against a virus. That's basically what I want. And the most important point I want to make sure is that providers actually make sure that they're not treating a bacterial infection as they treat a viral infection. Thank you.
TM, let just add to that. Thank you so much for your input. We're glad to say you were able to bring that in there up. I don't know, because we don't want to work in Salon, but I think people are waiting. But one thing I know is that because you cannot distinguish between the two most of the time, you definitely are allowed, we in our A&E, like me in our emergency medicine, immune specialty, that they work, so that the conveyor belt in first place done there. When people in the country, we suspect meningitis, obviously the rats, if you dip on black money, out posting like how we know. So when they come and we see them get the neck stiffness, the temperature, the pain, the headache, we they give the antibiotics, but then we they cover them for the virus as well. So now 2 things then they get. Then they get a cyclovir as well as the cotrimoxazole, in the adult, in the Peking Dayon, obviously according to within the local guidelines. So like that, So important for let we know say containing the bacterial one can mask as a virus, and at the same time, the viral one can mask as a virus. So because you don't know, you're always better off treating both that one of those days, no go and bug you at all. And by the time you wait for CRP, xanthochromia, and all that, you're looking at a few hours. And by then you don't lose the horse don't bolt. So importantly, when they come to we, even way like when they did at the GP practice, first thing they can do, then give them penicillin. It's as simple as that, because it's time critical. So when they come to we give them for both. That's just what I want to say. And then obviously we can adjust the treatment now as we get the results. Thank you.
Yeah, and TJ, if I can add to that as well.
Oh.
Now, because in the UK, because we know bacteria meningitis, prognosis more worse, than the viral and the other one. Then, if you're there in a community, the guidelines is, even from NICE, regardless of bacterial or virus, you cannot distinguish the two. The symptoms can be very similar. You give that one of those, because then they prevent. If saying a bacteria now, yes, it don't help them. If not to viral, and I make the microbiologist, as I mentioned, very important here. So all them tests they really do with the bloods, the CSF, and all them things, and they for find the definitive cause. Once the definitive cause is been found, then that's ending out. Then go with the treatment based on the cause. But now when they do blind treatment, you don't know what actually they deal with here. So you deal with the way, if you say this more dangerous. So the guidelines here is, in whatever remote place you did, when you suspect them, you give straight away. If the person not gets say anaphylaxis or any reaction to the penicillin, then you take and go to the hospital where they can go do all them tests then they, because in the community, if you say they go give somebody antiviral, now orally you go begin get IV drip and all them things. So you just give the IM injection, you go in the hospital, then go do all the rest. So then they not go affect anything we then get for go do at the hospital.
See me fambule. I tell you, I say I a book man then. Me get the beginning number, but then I didn't get the book. And for the one way Yegi Dr. Ture say nice. Not to me they call nice, so no, not to me. Na Bodi within a UK and the National Institute of Health and Care. Excellent.
Excellent.
And I they provide guidance for them professional there for make sure say they treat people to the best of their ability, to the best treatment with it, but also making sure so then they give value for money. So me family them, we done for today. I know say when I want to talk about when I want to talk, but we get a new week for begin, so we'll go for finish. Any good thing must come to an end. So,
Temu, I'm sorry, Temu, just before you go, I see somebody put in the group. You say question, please. I don't know what you mean, if you want for ask question or
yeah, sure. If you ask question, I beg you to ask question now before we log off, please. Yeah.
Yes. You ask question.
Chat. Question.
This PC.
I don't know that this PC.
Hello.
Hello, how are you?
Good day. How all do you do?
Hi.
Yeah, I'm Mohammed Khan, my name.
Okay.
The Gambia right now.
Yeah, what are your questions?
Okay. My question is if anything don't they in place for take care of this meningitis, like people that already come on at the region where they know say in a region we be in a of the world, we be in a countries or we be in a the internet in a really worsen. If they get any measure, they don't take they try to put in place as Nafisatu will talk about how they try for curb this and this disease. If any measure they don't put in place, the people they come inside, how they will check them for distinguish them for make sure they're not going to be they will carry out this disease and for bringing in other countries in other region or Alexalo or other country. We say they're not too much. And that I want to know. I also want to know. And a second question. I also want to know whether once this disease they overflow the brain, they from the head, all the layers of the head and the brain affect the brain and they kill. I want to know that if you don't do that at all, if you go affect the person in like backbone or the impact in the person, you see most of the time you go see somebody also getting kind problem in the. So I just want to know the inside and whether they gave any relation to that. I'm a question on it. Thank you very much.
Thank you so much. I go let sometimes maybe some of my colleagues they go touch part on the second part where they talk with they affect the person backbone. I think I may go through some complications. I don't remember I see specifically the backbone, but I know say when the doctor they physically examine you, it can look for one pallet test that will actually be shown on slide, that Canny test. It did look if you see the patient, they get backbone pain and all anything, but not in terms of complication, whether it can get any complication in terms of long-term effect on the backbone. So maybe some of my colleagues then will touch on that. But that other fourth part where you talk about the if they don't go, then country the way could they like the high rate of the disease, like the meningitis belt country, whether they know bring the sick can na other country when they travel. Well, now good question, Andy. When disease can be on side, traveling and one thing we can spread them. If you take COVID, for example, because of people when they migrate from one country to the other, then they bring on the infection. And you can't say, somebody no go travel because of he gets sick in a country. Sometimes they can ban traveling, but they can put measures in place. People are supposed to be vaccinated. Now, make they raise awareness, let people they are aware. Not only for you able to identify, say this is meningitis person don't get, but also for be protected against the meningitis vaccine. The best way for prevention na vaccination. Make sure so you protected. So even if somebody bring cancer to your country, you can't get contact with that person because you protected. Like me, when they work in public health, so me, we own passion now for protect and prevent something. If we get we nobody no go hospital safe for good kids. We want to let you know even reach to the stage where you go hospital. We want make you prevent them. Now I make all public health they talk about prevention. So yes, they will come with and likely say they will bring and come when they travel, but vaccination, you waiting at the country for you forget the government for put and say routine vaccine for make sure say we get them vaccinated as routine. Unfortunately, like we wait a salon, so salon men ACWI when I one of the vaccine that we recommended, not a routine. You can go forget and private. The few that way are routine where I just see two no more hemophilus influenza and pneumococcal. And not see said and they give meningitis B as part of picking routine vaccine na salon. So that's one thing we get in terms of the first answer. I don't know if any of my colleagues get anything for hard day. Obviously, the second part of the answer of in question and answer is about the backbone, back pain, or ultimately. So I will left to my colleague if they get anything for hard. Thank you.
Okay. Any more questions before we wrap up for today?
Anybody get anything for add to Mr.
I just want to add something. Yes, I yes. Give me your final word for today, please. And whatever contribution you want to add, please. If I will unmute yourself, I will not give you. Okay, there you go. The bluff. All right. Okay.
Yeah, you mean?
Perfect. Yes.
Yes. Okay. So just a couple of things. One thing I want to say is you, with all the knowledge we get, and Nafisatu, thank you so much. It was an excellent presentation. So with all the knowledge we will get, if you feel so you get meningitis, you want to go to hospital or in the contact with clinician, not where the for talk get to wait say you suspect meningitis. It go better make them eliminate that. Then they go help them for focus more quickly. So they go eliminate that, then they better than they go be asking more question so you get to the end. So that is one thing. Secondly, like if you're in England or even back home, Sierra Leone, if you feel so you get meningitis or you suspect you get meningitis, as you approach the hospital or the health center, I will tell them immediately so that they will isolate you. You don't go spread them to everybody else around you. So now that's what they know about.
Thank you very much, if I'm we can't finish for today, so I go around the team now. Mazita don't give you already, so I'll just go to Dr. Angela for say in last word and sign off for today.
Good afternoon, everyone, and thank you very much, Dr. Nafi, for such a wonderful presentation. In fact, I'm not gonna ask him for say he covered everything. Very detailed, very well organized, love the diagrams and everything. And in terms of public health, it make like I think I fit retire from this group because it's done good justice to the public health aspects. But thank you so much for the presentation and thanks to everybody who joined. And I not forget the word. And anytime somebody they complain of severe headache and the normal light, the neck they stiff, it's normal for make you put the light on, the neck they stiff. And I remember say when I think of meningitis, and as I said myself just say, make we go hospital, make it mention saying the suspecting at that so that then go eliminate them. But my family on not forget Bodi Beteh Gentri. Thank you for wanna join we and All the best. Over.
Thank you very much. I will provoke you later. You know how they count, I will provoke you later. I'll not forget. Auntie Rugi? Yes, ma'am. Make a
I'm
shot.
gone.
Don't run well after.
I know, yes.
How are you, ma'am?
Yes, another much for say. Thank you very much, Nafi. And also not meet yet. You don't say what join the group anyway, because at the work weekends, most weekends at the work. So but I just want to say thank you for the presentation and where you come from the picking inside, obviously. A lot of them picking the way they sick, then in Africa for that matter. A very difficult one, no waiting at the team. Yeah, so obviously we'll get to read book where all the vaccine and they where you take them, then go know if you don't take vaccine or not. And just for promote and I also back as well because we know for say shortage day where people and agree for give the picking and vaccination. So now we just continue for encourage people and for give them take the picking and hospital or now to GP, let them give them the vaccination then. Thank you.
Very much, ma. Senior Director, Her Royal Highness, Mrs. Kamara.
Oh, wow. Oh, I'm happy.
The last one, ma.
Ajanafi, well done.
Thank you.
Oh my goodness. This present, I learned so much. And I think I would just echo what everybody don't say, that help available. Now, for we find or understand the symptoms and we go make focus somebody go hospital. So especially we own Famble and a salon. This, if you get access to YouTube, this presentation go there, una access them and share them so that everybody go benefit. So thank you so much for una always join we. Nafi. Thank you. This is excellent. Thank you. That's all.
Thank you very much, Matikama. I will come to Dr. Bell. Dr. Bell, we also get nearest fertility consultancy. Alone for Una we feel say for woman them we feel say then well not just for woman them but people them within family man if you feel say you get something where they worry about born picking. But woman if you get woman issues them and stuff like that where you want to talk, you want to talk to somebody, ERSK will help you. That Dr. Bell, with the final word, you can give an overview of your business, but also give your final word, please. Kindly can short one.
The youngest fertility consultancy in an online platform where we're able for discuss fertility issues there with couples there when it's going to get speaking. But Nafi, thank you very much for the session. I mean, I don't get anything for add. Other people don't say within I want for say the one thing we with Bodi Better Pass is good for is that we send out awareness. We tell people them waiting them for do where it comes to some certain sickness. Yeah, that in a real area than they and I gladly say we do this because that man that in village, that woman in village, instead if you get in phone, they're able for watching YouTube video then. So we know say definitely this video will also Nafi, definitely you don't save one life, definitely. And we tell you thank you for that. We tell thank you to all the people that we on right now to the end. And please, owner, take the word, tell people them about this sickness as well, and make people aware, say help for them as well. As we all can say, well, Bodi Better Pass Gentri.
Thank you very much, Dr. Bell. Dr. Tuge, again, anything more you want to add before I go to Dr. Kamara?
Nothing much. I think Ajana Fido don't make this thing clear for we all, and we all don't learn so much. You say, and you don't answer all the questions there. The possible we talk about the backbone, back pain and bone pain. Except if you get sepsis, maybe you can get septic arthritis, or maybe when they take the injections from the back, you can get spinal abscess, which can lead to, the pain around that area, and including, the bone around that area. Right, but this mainly at the lining of the brain, and more they affect, they can down to the spinal cord down there. So even that signs away, Janafi they be talk about now, because the lining of the brain become inflamed and cause all them things in it. So we tell them now, thank you for the contributions they wanna make. We tell them that so much. Thank you. We hope soon I will join you again next time for we other session. So until we meet again, we all know say well body, better pass gently. Thank you.
Thank you very much, Dr. Kamara.
Yeah, I mean, everything don't cover anyway. I just for add to it in Ajanafi and Dr. Ray talk. You get things like problems with coordination, the movement and the waka and balance problem. That's one of the long-term side effects, complications of meningitis. And then, of course, you get arthritis, which can come from that. So, man, it can affect the spine so bad that the circulation at the limb in bad, it get compromised, and so therefore it can lead to amputations. So they can get for cut the leg come out. These are all part of the meningitis, which you can do, But as I say, 1 in 10 they die from this sick. Therefore, it's time critical. And what would they try for do? Now, for just try at least if now one life step we save, we need to say we don't do a job. So dear, fumble them. Now join we, when spread the word, when scatter the word, let people know say, well body, better pass gentry. If they want for hearing more, and then give it the topics then which they're interested in, we go do the work and then come back to honor. So remember, well body, better pass gentry. Not to gentry self, he better pass gentry. Thank you so much, and God bless.
Thank you very much. My family, plenty thank you for one. I don't stay on with tweeting now. Antinafi will give now in final word, and we will close for today. Antinafi.
Thank you so much. And I just want to tell everybody, thank you for all spare on our precious time for can listen to we. So do you, as everybody don't talk, remember say well body better pass gently. All the information they will don't talk now, yeah, not forget time. When I share the YouTube when it come out, when I'll get the YouTube videos, I will share some to me, contact them when I go able to get on our YouTube. The other one and owner will join today on our family, friends, neighbors, send them to them. Let them get a low threshold when they suspect anything they see and they say for a relative or neighbor or party way similar to what I talk now, making them immediately access healthcare. Remember, not go to that nurse where they up the road or that doctor or that pharmacist where they down the junction. Go to hospital. Because well body better pass gently. And thank you.
Plenty thank you. The video go there on YouTube soon. I hope say we, on our way will benefit from that, but if I also know somebody will benefit from them and I share the link, let people there. Whether they make no money out of them, so not say I'm at the talk this because we want to make penny out of them. No, he did it for free and he open to anybody at any time for the UVM. Okay. And by God power, if you download today, maybe I will get them uploaded today. So now we will get them available. So if you miss a part of them, it will still be available. Well, till we meet again, my name is John Fuller. Well, body. A better part gently. Good night.